The way of learning. Today's topic is white blood cells exhibited for staff nurse interns. First question is the immunity an individual develops after acquiring an infection is called option A active immunity, option B passive immunity, option C herd immunity, option D all the above. Correct answer is option A active immunity. Next one is how many months baby use only mother's immunity? Option A 3 month, option B 1 month, option C 12 month, option D never use. Correct answer is option A 3 month. Next one is immunity acquired from DPT vaccination is an example of option A active immunity, option B cellular immunity, option C passive immunity, option D herd immunity. Correct answer is option A active immunity. Next one is tetanus toxoid is an example of option A active immunity, option B passive immunity, option C natural immunity, option D herd immunity. Correct answer is option A active immunity. Next one is which of the following is an example of passive immunity? Option A transfer of antibodies from mother to baby, option B exposure of infant to tuberculosis, option C providing toxin to an individual, option D providing BCG to an infant. Correct answer is option A transfer of antibodies from mother to baby. Next one is in which of the following does the immunity occurs naturally through the transfer of immunoglobulin across placenta membrane? Option A active acquired immunity, option B innate immunity, option C antigen, option D passive acquired immunity. Correct answer is option D passive acquired immunity. Next one is all of the following provide passive immunity to the infant except option A maternal antibodies, option B breast milk of mother, option C development of disease, option D vaccination by transfer of antibodies. Correct answer is option C development of disease. Next one is the transfer of antibodies from mother's milk to the baby is called option A artificially acquired passive immunity, option B artificially acquired active immunity, option C naturally acquired passive immunity, option D naturally acquired active immunity. Correct answer is option C naturally acquired passive immunity. Next one is which of the following is used for passive immunization? Option A human and animal sera, option B killed vaccine, option C live attenuated vaccine, option D taxoid. Correct answer is option A human and animal sera. Next one is passive immunity against tetanus is obtained by the administration of option A DT, option B TT, option C DPT, option D tetanus immunoglobulin. Correct answer is option D tetanus immunoglobulin. Next one is which of the following involves the introduction of antibodies into the body from an animal or person who already immune to the disease? Option A active immunity, option B naturally acquired passive immunity, option C artificially acquired passive immunity, option D innate immunity. Correct answer is option C artificially acquired passive immunity. Next one is which of the following is the way to acquire passive immunity? Option A vaccination, option B exposure to subclinical infection, option C antibody transmission. Option D, exposure to disease. Correct answer is option C, antibody transfusion. Next one is the administration of ready-made antibodies is called as option A, natural active immunity. Option B, natural passive immunity. Option C, artificial active immunity. Option D, artificial passive immunity. Correct answer is option D, artificial passive immunity. Next one is when antibodies are produced inside the infected body, it is called option A, passive immunity. Option B, active immunity. Option C, both A and B. Option D, none of the above. Correct answer is option B, active immunity. Next one is which of the following is not a potential source of acquired immunity? Option A, antibodies received in response to disease. Option B, antibodies received from the mother. Option C, prescribed multivitamins. Option D, animal serum. Correct answer is option C, prescribed multivitamins. Next one is diphtheria antitoxin is given to susceptible contacts immediately after exposure. Diphtheria antitoxin is option A, atoxoid. Option B, a kill vaccine. Option C, an antisera. Option D, a live attenuated vaccine. Correct answer is option C, an antisera. Next one is a child comes to the hospital after exposure to diphtheria and is given antitoxin. This type of immunity is known as option A, active natural immunity. Option B, active artificial immunity. Option C, passive natural immunity. Option D, passive artificial immunity. Correct answer is option D, passive artificial immunity. Next one is a type of immunity that occurs when the vaccination of a portion of population provide protection to unprotected individuals is option A, passive immunity. Option B, contact immunity. Option C, herd immunity. Option D, active immunity. Correct answer is option C, herd immunity. Next one is the level of resistance of a community or group of people to a particular disease called option A, passive immunity. Option B, active immunity. Option C, herd immunity. Option D, cellular immunity. Correct answer is option C, herd immunity. Next one is herd immunity does not protect individual in option A, diphtheria. Option B, poliomyelitis. Option C, smallpox. Option D, tetanus. Correct answer is option D, tetanus. Next one is all of the following about tetanus are true except option A, herd immunity is present. Option B, tetanus protection is for 5 years if previously immunized. Option C, cannot be eradicated. Option D, elimination is less than I case per 1000 live births. Correct answer is option A, herd immunity is present. Next one is all elderly tend to be more susceptible to infection because of option A decline in immune function. Option B, poor nutritional status. Option C, lack of exercises. Option D, increased exposure of pathogens. Correct answer is option A decline in immune function. Thanks for watching. Like, comment and subscribe the channel.